So you use lasers in your practice. How?
Daily. Is they're not. I have a laser that we call the water lace. It's a very expensive piece of equipment that I have. And when my friends come to my practice, they tell me, Daniel, you have a lot of toys. But to be honest with you, these are not toys. These are my working tools. Because I have lots of patients that come to my practice and they have gum disease. Besides doing the treatment that we have to do, we treat with lasers. The healing process is so fast. It's incredible how the body reacts once we use lasers. I tell my patients the miracle is going to happen. The way it heals is beautiful. Sometimes I'm doing same-day crowns, and I have this bad tissue, so I get my laser out and I clean everything that I have to do so I can expose this beautiful tooth, so I will get this beautiful restoration on top of it. So laser dentistry in my practice is a daily basis thing. When we explain to the patients we're going to be using laser, they're thinking, oh wow, it's going to be something expensive or painful, but it's not. Why? Because most of the treatments that I do is part of the treatment. I'm not going to charge you more because I'm using a laser. It's a tool that I need to make a beautiful restoration in this case, or help you for your gums to heal.
Okay.
It's just a working tool that I have. And when it comes to pain, it's incredible because I tell them, you're not going to feel pain. It
seems
not,
painful.
No, I just show them, the little red beam, it's just a little red beam, okay? And when I start using it, patients most of the times are numb, and they go like this. I ask them, did it hurt? So no, doc, it didn't hurt. So I'll call you tomorrow, see how you're doing. And when they come back a week after, and we see these, the tissues they're healing is so beautiful, I go like this. What do you think about now? And they go, lovely. We love it.
Good.
Thank you, Dr.
What about
Vasquez.
gummy smiles? Things like that. Do you use it in combination with gummy smiles?
A lot of times. When I do aesthetic cases and I get the smile, sometimes we have a lot of gum. So the best way to do it is we say to the patient, you have a little short, fat tooth. It doesn't look good, but I like the long, skinny teeth.
Okay.
But you have too much gum. So how about if we go into custom trim, okay, very artistic, your tissue, so we can expose more tooth. And they go, wow, can you do that? Yes, we can do it. We're going to do it with lasers. Before we used to do it with scalpels. Bloody, terrible. Today I use my laser, and it's just the immediate rewards we have using this kind of technology, and the patients smile. And go, something is, it's going to look a little bit red because we just finished doing the surgery, but how beautiful are your teeth. And
nice.
they just love it. It's laser again, we do it in many things. For an example, I do it on my root canals because we do a lot of root canals. And what happened on a tooth that needs a treatment like that, it's just full of bacteria. All these little canals that we're working, they're full of bacteria. So at the end, before I seal and I finish this root canal, I'm not going to explain because it's too much, but if I seal it, I come with my laser, and what I do, I actually sterilize the canal. Why? Because the laser, what we do, we're just killing bacteria. So we sterilize the canal, we seal. One of the things that I notice after I do root canals is I ask my patient next day, how was the pain? Because my biggest enemy in dentistry is pain.
You don't like pain?
I don't like pain. I hate pain. And I'm going to work on you without pain. Laser dentistry is a painless procedure, and I make it to be painless too.
So you have your own CT right there in your practice?
Oh yeah. I had to get my CT. And the main reason behind the CT is because today I think that's standard of care. I can see things in a three-dimensional way. It's my best diagnostic tool that I have in my practice today. Patients have come and said, Dr. Vasquez, I have some pain here, and we take traditional x-rays. I don't see nothing. I can't see nothing. So as soon as we put the CT, we take the computer tomography. Then I exactly know what tooth is having the problem.
Okay.
That's one. Number two, today, having the CT, I'm increasing the amount of implant that I'm doing today. Why? Because with the CT, I'm able to see things, prepare, trim implant, and implant. I know if I have, bone enough, to place the implant right there. If I have to do an extensive procedure, we're going to plan that ahead of time. Now, having the CT in my practice also, it allows me because we do wisdom teeth in our office too. So we take the CT, I can follow a nerve, and I say, something, it's safe to pull your wisdom teeth. It gives me confidence. Before, you're kind of shaky, can I do this, cannot? But today, no, I do things with confidence.
Now, when you say it's less downtime in certain procedures because you have your own CT there.
Correct.
Elaborate on that. What do you mean? Why would it be less downtime?
Well, less downtime because most of the times, let's say a patient comes for an implant consultation, and this is what I used to do before. Something? Yes, I think you're a good patient, a good candidate for an implant right there. But in order for me to do this procedure, you need to go 20 miles away from here so you can get a CT for me. Okay. So they have to go to an outsource the X-ray, and most of the times patients don't go. So I go.
So you don't see them again.
You don't see them again. So I realized, I noticed when you go to the store and the cash register, what do they have? One of my weakness, Randy, it is Snickers. Okay.
Snickers, your weakness.
Oh, that's my weakness, Snickers, and they have them just in front of me
Yeah.
before I check out. So I go like this. I put the Snicker. So using the same analogy, why send and outsource this X-rays when we can do it in home? We bring the CT. Something? Let me give you the answer right now. We take it, and most of the times when we're doing these X-rays, and I'm doing an implant consultation, we don't charge for this X-ray. Why I'm going to charge something that I need to see?
Okay.
No, it's going to be for that consultation. It's going to be free, and also for my implant. So I get to see if I have the enough bone, how big, how wide implant I'm going to put in there. And again, with the integration with the technology of CAD/CAM and crayons that we do in the same day, I can make a surgical guide, the same appointment. It takes only about 20 minutes to make the surgical guide.
Okay.
And I can place an implant the same day. Patient come for
And make the tooth and put it on top?
and I can make and put it on top of it, yes. So, what is the downtime? I don't outsource my X-ray.
Okay.
Okay. I'm treatment planning the same day. It takes me about 10, 15 minutes to do that. The patient gives me the okay. It doesn't need to come back another appointment. The patient doesn't need to miss another day of work because I'm going to do it right there. The guide.
Nice.
It's going to be done. We have the implants. We put it. It takes about 7, 10 minutes to put an implant. It's going to take more time to put a crown on top of it. But also that will be done in about an hour. So I'll say if you come as a consultation and you decide you want to do the implant the same day, it's going to take me about 2.5 hours, the whole process. So you know how much downtime and how many visits I save this patient coming to my practice? So in the long run, it is not more expensive.
So make sure the dentist you go to has a CT.
Oh, yes.
I know you'd prefer they just go to you. But
Yes.
CT, I mean, you couldn't practice without your CT. I think you
can't.
told me that on the phone.
I just can't. CT is just a big part of my practice.
But a lot of guys don't have CTs. A lot of other dentists.
Well, that's your problem, not mine. I'm sorry. It's, I stop the guessing game. I in my office, I don't guess.
So it's
no
very
more.
precise.
It's very precise.
Interesting. Good.
And besides that, being precise, it gives me the comfort, and it stopped me guessing about things that I can do today.